Normally sebaceous glands are seen on the skin. They are seen usually on the skin. Okay, sometimes what happens is they can be seen even in the oral cavity also. So those ectopic glands, okay, so those ectopic sebaceous glands, we are in the second part of the image based discussion. We have started with the developmental disturbance, and that too the images related to developmental disturbance, where Fordyce's granules is this image. This is the image that we have to see, and where these are yellowish granules. Now this is an image of a double lip. Double lip is associated with typically the syndrome that is Asher syndrome. Asher syndrome. Double lip is associated with the syndrome called as Asher syndrome. Now this is our first image, that is the lower lip pit, that is associated with the Van der Waals syndrome. So these images are very classical. They are typically asked. They will give you this image and they'll ask you to identify this name or identify the syndrome associated with this particular condition. Okay, so double lip is over, lower lip pits is over, Fordyce's granules is over. Okay, now these are nothing but the Epstein pearls. Now what are Epstein pearls? Again, these are nothing, some disturbance which are actually, they look like gingival cysts. All of us know about the gingival cysts, right? So gingival cysts of newborns. So even these look like same gingival cysts only, whitish colored nodules. But the difference here is that these nodules will occur along the mid-palatine raphe. That is why these are described as Epstein pearls. So you should be able to identify the diagram image of an Epstein pearl. Now this is an image of gemination. Now what is gemination? Gemination is basically developmental disturbance of shape of the tooth. In this particular developmental disturbance, what happens is the tooth bud attempts to divide into two. So it appears as if, you can see in this image, it appears as if the tooth is attempting, in the second radiograph you can see carefully, there is a notch there, right? So the tooth attempts to divide, tooth bud attempts to divide. That is why you will see that notch on the surface. So this is a gemination. So gemination definition itself says that it's an attempt of a tooth bud to divide into two. Attempt of a single tooth bud to divide into two. That is nothing but your gemination. So when you count the number of teeth in gemination, usually the number of the count will be same. If we count the number of the teeth will be normal. There won't be any variation in the number of the teeth. Whereas fusion, if you can see this image, fusion. So fusion is typically another developmental disturbance where you will see that the two tooth buds are fused to each other. So thereby it appears as a double tooth. So in the radiograph you can see that there are two crowns which are fused together and there are two separate roots. That is the most common type of fusion that you will encounter. Okay, that's the most common type of fusion that you will encounter. That fusion is nothing but the union of the two tooth germs or tooth buds at the level of dentin. At the level of dentin. Now this is a concrescence, where concrescence is union of the roots. The cementum usually gets united. So this union of the roots is known as concrescence. So don't get confused between the concrescence and the fusion. Both are same. One is at the root level, that is the cementum. One is in the crown level, that at the level of dentin. It's not that, remember, it's not like fusion doesn't involve root. Fusion can involve roots, but it's a rare thing. Usually fusion means which is union at the level of dentin. Okay. Now this is another radiograph to show the concrescence. Concrescence, we have to remember that concrescence typically affects the maxillary molars. It typically affects the maxillary molars. Okay, this is an image of Talon's cusp. Talon's cusp is one particular condition where you will see an extra cusp on the lingual surface of the uh, uh, tooth. Usually you will see this on the maxillary lateral incisors. Usually you will see this on the maxillary lateral incisors. This is an extra cusp. This is dens evaginatus. Evagination means outward projection. So dens evaginatus is one developmental condition where typically it appears as if on the mandibular premolar, you can see this, on the mandibular premolar, you will see one globule, extra cusp. That is nothing but your dens evaginatus. It is also known as Leong's premolar. It is also known as Leong's premolar. You have the point that we have to remember here is that typically this will affect mandibular premolars. This will typically affect the mandibular premolars. This is a dens invaginatus. Now in dens invaginatus, what are we supposed to remember here is that, what are we supposed to remember in dens invaginatus is that this typically occurs as if one tooth is enclosed within another tooth. One tooth is enclosed within another tooth. That is your dens evaginatus, dens invaginatus. It is also known as a tooth within the tooth appearance. Tooth within tooth appearance. I hope, please let me know in the chat box, those who are watching, if there is any lag in the audio and video. Is everything fine? Now here, what are we supposed to remember is that you have to remember the names. You have to remember this image also. First of all, you have to remember this image also. That typically as if one tooth is enclosing another tooth. And you are also supposed to remember the alternate names. Dens invaginatus is also known as, okay, what are the other names of this? Dens invaginatus. Now this is an image of Enameloma. Now here Enameloma is basically a developmental disturbance in which there is an extra pearl or ectopic enamel on the root, that too in the furcation area. On the furcation area. So this Enameloma is not a tumor. Please remember, it appears, oma means a tumor. It's actually not a tumor. It is a extra globule of enamel. Now this is a Taurodontism. Now all of us know Taurodontism is a bull teeth. So this is a typical radiographic image that we are supposed to remember, where you will see that the crown appears as if it is very large, enlarged. So here the crown appears to be enlarged at the expense of the root. Crown appears to get enlarged at the expense of the root. That is nothing but your Taurodontism. So Taurodontism is a radiographic term. What we are supposed to remember is it is a radiographic term. This is another image of hypercementosis, where we can see an extra mass of cementum. Okay, so this excessive cementum deposition that you can see on the root, this excessive cementum deposition is typically seen in case of Paget's disease. Generalized hypercementosis, when I am talking is generalized, not localized hypercementosis. Generalized hypercementosis is a feature of the Paget's disease. Now this is an image of dilaceration, where we can see that the root tip is bent. Root tip is bent. So this bent root tip is known as dilaceration. So dilaceration it occurs in the apical 1/3 of the root. However, it can involve even the crown also. It can involve the middle part of the root also. Anywhere it can involve. But apical part of the root is the most common area where you will see dilaceration. Now this is an image to show the dilaceration. Radiographic image where you can see the root tip is showing the dilaceration. Now this is an image of dilaceration due to odontome. Now dilaceration can occur because of many reasons. Whenever there is any pressure applied on the developing tooth, then you can see the dilaceration. So in this case, because of the odontome, developing odontome, we are able to see the dilaceration. Now this is a case of the hypoplastic amelogenesis imperfecta. Now here, amelogenesis imperfecta, we know that is basically a type of enamel hypoplasia, hereditary type of enamel hypoplasia. This is typically type 1. How to identify this image? This is a very characteristic image. We have to identify this image by seeing the pits. So pitted surface, pitted enamel surface is a very characteristic feature of the hypoplastic amelogenesis imperfecta. Yes, symmetrical. Now this is a Turner's hypoplasia. Remember that Turner's hypoplasia is basically a type of enamel hypoplasia due to infection or trauma occurring on the deciduous tooth. Suppose a deciduous tooth gets damaged, the permanent tooth below that will have this Turner's hypoplasia. Remember, it's a localized enamel hypoplasia. So again, this is a very characteristic image that we are supposed to remember. Turner's hypoplasia. Now this is an image of snow-capped teeth. Now what is snow-capped teeth typically? Snow-capped teeth is nothing but, we can see all the encircled, whatever I have encircled. See, those are the areas of hypoplasia. Actually, it's a type of amelogenesis imperfecta, which is typically seen in type 2C. Type 2C, where we can see the opacity involving the incisal edges and the cuspal tips. Those, because of that opacity involving the cuspal tips and the incisal edges, we call it as snow-capped teeth. Snow-capped teeth. Now this is an image of molar incisor hypoplasia, where you can see carefully this molar incisor hypoplasia typically is known as cheese molars. Why it is known as cheese molars? Because typically it will affect the molars and the incisors, and it will have opacity involving only the permanent incisors and the molars. It doesn't affect premolars, it doesn't affect the canines. It will affect typically the incisors, that too specifically usually central incisors. It can involve lateral also, cheese molars, molar incisor hypoplasia, but it will usually typically affect the central incisors and the first permanent molars. Now this is an image of Dentinogenesis imperfecta, where we can see that in this image of Dentinogenesis imperfecta, there is brownish discoloration of the teeth. Typically, what are we supposed to remember is, whenever we get a discoloration, image regarding discoloration, if they say brownish discoloration of the teeth, and if they give you a history that pulp is obliterated, then typically it will be your answer, that is Dentinogenesis imperfecta. Otherwise, if they'll give you brownish discoloration of the teeth and they will give you a finding of UV fluorescence, if they say that brownish fluorescence is the reddish brown fluorescence on UV light, then it will be answer of erythropoietic porphyria. Erythropoietic porphyria. So those even porphyrias will emit brown discoloration when you use the UV light. When you apply the UV light on the tooth affected with the porphyria, so there what happens is these porphyrins which will be there, they will because of that there is a reddish brown, there will be a fluorescence that is emitted. Okay, so that is why usually discoloration of the teeth, you should imagine whether it is tetracycline staining, whether it is Dentinogenesis imperfecta, whether it is erythropoietic porphyria, that you have to diagnose first. Okay, that you have to diagnose first. Now this is an image of typical Dentinogenesis imperfecta radiograph, where we can appreciate that there is no pulp at all. There is no pulp at all. You can see that totally the pulp is obliterated. Totally the pulp is obliterated. Even in osteogenesis imperfecta also the pulp is obliterated. So you have to remember the two important thing condition. One is that one is disease of bone, osteogenesis imperfecta. Another is the developmental disturbance of the tooth, that is dentinogenesis imperfecta. Now this is an image of dentin dysplasia, where you can see in the dentin dysplasia type 1. What is type 1? It is a rootless teeth, which affects only the roots. You can see here in the clinical image, we can see that there is no discoloration of the tooth. Looking at the clinical image, we can't say that this is dentin dysplasia. It's totally normal. Discoloration is totally, there is no discoloration at all. Okay. So however, when you take a radiograph, you will see that the roots are very small, and we can appreciate even the periapical radiolucency there. That is all that you see in case of dentin dysplasia type 1, that is rootless teeth. That is rootless teeth or radicular dentin dysplasia. Now this is dentin dysplasia type 2, which affects the crown, and in this radiograph we are supposed to appreciate the enlarged pulp here. We are supposed to appreciate the enlarged pulp, and this enlarged pulp is typically seen in case of permanent teeth of type 2 dentin dysplasia. Permanent teeth of type 2 dentin dysplasia. Now this is an image of ghost teeth. Ghost teeth is typically an image where it is typically seen in case of regional odontodysplasia. Regional odontodysplasia. So where the pulp will be enlarged and the enamel and dentin will be thin. Enamel and dentin will be thin. Now this is hyperodontia, where you can see extra teeth. Hyperodontia is extra teeth. There are supernumerary teeth is nothing but your hyperodontia. Now this is an image of natal teeth. So natal teeth is the teeth that are seen at birth. They are called as natal teeth. So neonatal teeth is nothing but the scene which is seen within the 30 days of the birth. Now this natal teeth and neonatal teeth, can basically cause damage to the tongue of the infant during feeding. That is called as Riga-fed disease. Riga-fed disease. Now this is an image of geographic tongue. Geographic tongue is nothing but a deep appellation that you see on the tongue. This deep appellation is serpentine. It is called a serpentine description. What is serpentine description? Snake-like deep appellation will be seen. Even though there is so much of deep appellation, the patient is asymptomatic. The patient is typically asymptomatic. This is median rhomboid glossitis, where you can see on the center of the tongue there is an area of deep appellation. So this area of deep appellation is characteristic feature of median rhomboid glossitis. Remember that it is because of candida. It is not because of any developmental disturbance. Actually, it is a fungal infection. It is actually a fungal infection. Now this is an image of fissured tongue. Now this fissured tongue is typically seen in case of one syndrome called as Melkerson-Rosenthal syndrome. Fissured tongue is typically seen in case of one syndrome called as Melkerson-Rosenthal syndrome. That syndrome is very characteristically important, because lot of MCQs comes usually in different papers. It has got a triad actually. This syndrome has got a triad. It has got 3 components. Okay, very characteristically they'll ask you this fissured tongue as an MCQ. We have ankyloglossia or tongue tie. Ankyloglossia or tongue tie, where you can see that there is a short lingual frenum, and that lingual frenum is attached to the tip of the tongue and to the floor of the mouth. That is called as the ankyloglossia. Okay, now this is the last image of today's session, that is cheilitis granulomatosa. Cheilitis granulomatosa is typically a part of the Melkerson-Rosenthal syndrome, where you are going to see that the lips are enlarged. those enlarged lips are known as the cheilitis granulomatosa. Okay, in this condition you will see the basically this you will see in case of the Melkerson-Rosenthal syndrome. Okay, so this is the topic for today's session, that is a developmental disturbance. This is a part 2, image based section part 2. In the next part we are going to deal with the tumors. We are going to see the benign and malignant tumors, where we are going to discuss about the images that are there. That's a very important topic, and a lot of images come on that. Okay, so that we are going to see in the next week session. Okay, any doubts? Anyone who is just, or any, you can put a comment, you can post a comment there. I'll be able to solve your doubt. Okay, so these images are very characteristically asked. Okay, you can see this video and you can try to identify, try to remember those images. Okay, classically particularly the radiographs are very frequently asked. Okay, thank you so much.